The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center and Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist. And joining us by phone is our guest, Mark Adams, Health Commissioner for the Henry County Health Department and former Director of Environmental Health at the Canton City Health Department. Mark, it's great to talk to you and great to have you on the show.
You too. It's great to be here. It's great to talk to you guys again.
You got any snow out there?
We got about an inch, but I'll tell you what we do have is a lot of wind. I went from a place that was, Stark County being kind of hilly to it is so flat out here.
Well, you got windmills then, right?
We do, yeah. Wood County's got a lot of them. I don't know if I have any here in Henry, but Wood County's got quite a few of them. I pass them all the time.
Well, supposedly a study, the state of Ohio showed that the Toledo area was the best place to put windmills.
Oh, I can completely believe that. It's the topography is perfect for it.
Yeah, for sure. Well, it's good to have you on the show.
Oh, it's great to be here. It's great talking to you guys.
All right. Well, it is impossible to escape the news and concerns spreading in both our community and globally about coronavirus. Locally, as healthcare professionals, our concern is directed toward influenza currently. Statistically, we can expect an 8% of the population to develop the flu, 1% of those with influenza to become ill enough to require hospitalization, and 0.05% of people with influenza to die from the virus. If you're wondering how the coronavirus compares to influenza and what our state and local health departments are doing about coronavirus, stay tuned to today's show to get answers to all those questions. We'd like to remind our listeners today that our program is available on our podcast. You can search the App Store for Health Matters with the Medicine Center Pharmacy and listen to any of our programs anytime. You can also post up your questions you have today to our live Facebook feed.
So, Mike, we are again excited to talk to you today. Remind our listeners about your background and tell us how things are going in Henry County.
Sure. I was at the Canton Health Department for 25 years, leaving there as the Director of Environmental Health, and 2 years ago came out here to Henry County to serve as the Health Commissioner. And things are wonderful. It is a completely different change in public health, going from a lot of environmental health issues that exist around sanitation and issues like that to coming out to one that deals now with sewage or dealing more with, a health department in a much smaller county provides a lot of the other types of health care. For example, in Henry County, we have only had a pediatrician part-time for a very small period of time, one pediatrician.
Wow.
So the health departments out here in Northwest Ohio have to provide a lot of that care or be able to contract with somebody or work with other people to provide that care for the citizens to make sure that they're just as healthy here as they are in other places that have more resources. So it has been a pleasure to be out here. I went to the University of Toledo, and so it's kind of like a homecoming.
So tell us where Piqua, our listeners, where Piqua is. It close to Toledo or Dayton?
It is. It's about an hour. Piqua is an hour south from Toledo, and let's see, it's about an hour and a half south, right off 75.
Okay. I went to school with a couple of people from Piqua, Ohio, and that's the only reason I've ever heard of the city. Okay.
Oh, yeah. Okay.
So what's the population of Piqua?
Piqua, I don't know. It's probably around 8,000 or 9,000. Okay. My main town here is Napoleon, which has 8,000 people in it, a little over 8,000.
Okay. I had a roommate from Napoleon, too.
Oh, okay.
All right, so I guess we better get on with it here. Our main purpose for getting you on the phone today is to talk about the coronavirus, and that's the biggest thing going right now as far as worldwide discussion and whatever, along with the flu. So
it is, yeah. It's taken up a lot of the airwaves.
So let's talk about what it is. What is the coronavirus, and why is it named so?
Well, it's named as such because of the way it looks. If you look at it, it's this round virus that has these spiky projections. And those and it resembles a crown. So it easily was named a coronavirus after the word corona, which is in Latin. So there are pictures all throughout the web that kind of give you a depiction of what it looks like. So that's why they call it a coronavirus. And there are 7 coronaviruses that can be transmitted from human to human, several different types. And to give an example, people might remember if I mentioned SARS back in 2002, 2003, or MERS, Middle East respiratory. So it's those 2 were also coronaviruses.
So would you speculate that we'll see? I think they're formulating the new vaccines for the next season. Would you suspect that that'll be one of the components of the flu or some other vaccine?
Well, I have heard there has been information that people that are working on the virus, on a vaccine, they might have one available in 2021. Would it be part of a vaccine for flu? Now, there's 2 different things that I have heard, 2 different companies working on. There's one company that is working on an all-for-one flu vaccine, where it would it'd be 3 shots. They were testing it right now, and that would handle all flu. But I have not heard about them combining anything with coronavirus to be able to do that as well. Different type of virus. It would. It's a different type of different shape. And when we create viruses or create vaccines, we have to do it in a lot of cases with as much information that we have to be able to with the physical shape of that virus itself. So it would be. I haven't heard it in any type of virus yet. Any information that would show that there would be a combined vaccine for that. They would probably do something a little bit different. So, for example, they don't have a vaccine yet for SARS or MERS.
Wow. Okay. Well, why do they call this the novel virus?
And that's a simple one. It's novel because it's new. So they discovered it around the 3rd week of December 2019. Now they have moved away from calling it coronavirus 2019 to COVID-19, which means CO for coronavirus, VI for virus, and D for disease, and then -19 for because of the year it was discovered. So it's called novel because it's new. And this one was not identified prior, and especially not be able to identify prior to human-human transmission.
Okay, so we're hearing all kinds of stuff about where this came from. The first thing I heard was it came from a food market in I don't remember the name of the city, but it actually came from snakes, and now they've changed it to something else. Where did it come from?
In most cases, coronaviruses are easily carried by bats. And interaction, they don't know exactly how that interaction took place between a bat and a snake and how it resided in that snake. But I have heard and have seen information from both WHO and CDC, and that's been reported to us, that because we have to, if we're going to prevent it, we have to know, and we're going to create a vaccine, we have to know where it started. We have to know everything we possibly can about that virus. So that's why we try to find out exactly where it was coming from. And how that transmission went from animal to animal to human. So in this case, we suspect that the market that had snakes, that it somehow, by handling those snakes, a human was able to get it. Well, that happens. It happens that we can get something from an animal. We pay attention to that. It's a concern to us. But the main concern is when it goes from human to human, because of how mobile we are. So if you think about if we do confirm that it was transmitted from snake to human, that snake, it's already in the market. It's not that mobile, but we are absolutely that mobile, and especially we're global. And it concerns us when it goes human to human because of how fast we can spread it.
Well, I think it's really interesting that some of these people can't even get off the ships. I just heard the news this morning that one of the ships was finally allowed to dock at Cambodia. And I guess if you want to get off a ship anywhere right now, but at Cambodia, it's not exactly where I would want to be.
Well, and you want to go somewhere where there's the best medical care possible, sure. And there are just a lot of places that cannot provide medical care like we can in this country and in other countries with advanced medical care. So it's there was the cruise ship that is nearing at the end of its second week that's been docked in Japan. Mm-hmm. That one is nearing its second week. There have been quite a few Americans that have been interviewed on that one. I believe at last night, 58 confirmed cases, but I know that number has changed now. So, but yeah, it's there are cruise ships, and there are a lot of places that are saying, no, you're going to have to stay somewhere. There are too many cases spreading too fast. Think about a cruise ship. It's going to have upwards of 5,000 people on this very tight space, and talk about easily transmitting a virus and getting it around.
Sure.
I know that we'll end up talking about how it's transmitted and how it moves around. You've got the perfect storm there, especially on a cruise ship.
So what about the symptoms? Aren't they about the same as the flu?
Absolutely, almost identical. In fact, everything, even when it comes down to prevention, almost exactly like flu. So it's they're very similar with that general malaise, fever, and that's why you might see them using thermometers on the forehead to look and see if a person is already experiencing a fever, and that's where they've been stopping some people from leaving certain areas of China or before they enter certain areas. That's their quick way of doing it, and the only other way of doing it would be, of course, doing a confirmed lab test to find out.
So you get off an airplane and they check you getting off. What do they check? Just your fever?
Well, in some cases, depending on what border they're trying to cross, especially when they were trying to leave Wuhan or enter either into Hong Kong or some areas. In the very beginning of this, about 3 weeks ago, when it was really starting to ramp up at the end of January, when this started to become global, they immediately started doing checks with just fever. So they were using a handheld infrared thermometer and looking at aiming at the forehead and being able to see if they had any elevated temperature at all. And then you get pulled to the side, and then you go through a history. Okay, where were you? Did you do any? Where were you visiting? Where are you coming from? Did you have any interaction with this area or this town? And through that questioning, then a person becomes, they might then place them in quarantine or refuse them entry. So that's how it kind of starts. But the only way to really do it is do confirmatory testing in a lab.
Okay, Mark, we're going to take a break here. All right?
Yes, sir.
We'll be back in a couple minutes.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
We're ready for Valentine's Day at the Half Off and Hot Buy store in Louisville. All kinds of candy from Anastasiades to many other brands. Valentine candy bags with a Thai Beanie Baby Sweetheart Bear and many other gift items. Our store also has a new look with all kinds of new merchandise all over the store, with more coming in this week. We also make up special Valentine gift bags to your order. Stop in and you can see how great the Half Off and Hot Buy store in Louisville really looks. See our website, halfoffhotbuys.com, or call us at 330-875-6190.
Visit Studio Arts and Glass and shop for your Valentine. We're featuring unique jewelry handmade by American artists, sterling silver, semi-precious, and precious stones. Also, make sure to check out our selection of fabulous gifts created by local artists. Our friendly staff will be happy to assist in choosing and wrapping the perfect gift for your Valentine, because she's worth it. Open Monday through Saturday at 9 a.m. on 77 and Apple Grove in North Canton.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Mark Adams and discussing the Health Department's response to coronavirus.
All right, Mark, let's talk about how the virus is spread. And we're talking about the coronavirus here. And is it any different than the flu virus?
Not really. It's spread kind of the same way. So if we are infected, we cough, sneeze, those droplets, a person is very susceptible if they're within about 6 feet of a person that's sick. So that's kind of far away when you think about what 6 feet is. So it's like the flu, and coronavirus can be spread easily from human to human because of those droplets. And also those droplets, if they land on a surface, or if a person uses their hand and they cough into their hand, that virus then gets transferred to that surface. It's viable for quite some time, and that person that comes in behind it, and another person, and touches that surface, that same, whether it was a door handle, a phone, a computer keyboard, they can then, and if they touch that to their mouth in any way, they can then get sick. They can transfer that virus to themselves. So it can either be human to human through the droplet in the air, or human to human through the droplets that have landed on a surface, so from surface to human.
Okay, I know you've got some stats. How does coronavirus compare to influenza, SARS, and MERS?
Okay, so if we look at MERS, Middle East Respiratory Syndrome, that has about a 35% fatality rate. So that one's a high, very extremely high. If we look at SARS was about a 9% mortality rate. Right now, coronavirus has actually gone down a little bit from its original to about 2%. It was at around 2.5%. So we have there is a live feed so we can track this. And right now there's a total overall 64,000 cases, a little over 64,000, and 1,300 deaths. And the recovery rate is starting to go up. So if we just looked at flu last year alone in the United States killed a little over 30,000 people, estimated over 30,000 people. So it's with millions of people, approximately 32 million people affected, 16 million people going to the hospital, meaning that about 16 million people kind of stayed home with symptoms. They didn't seek out care. Hundreds of thousands of people being admitted to the hospitals with flu. With coronavirus, it's so much less. Now, I don't say that to be able to say, all right, let's not pay attention to it. But any time that we have a virus that we don't know a ton about, that has the ability to go human to human, we want to know everything about it. Well, just because it's not killing everybody, and just because it's not, I think some people have used Resident Evil movie and Raccoon City, and we're not there. We're not even close to there. But just because we're not close to there, and just because the mortality rate or how many people it's killing in a population isn't high, doesn't mean we know everything about it, because it always has that potential. A virus is no different than us. I mean, with a human, every living thing has we change our genome. Every time we have children, they take on traits of both mother and father. Every time that happens, the viruses do the same way. They change, and when they do that, they can adapt, and they look a little bit different in their next progeny. So it's we want to know everything about it. That's why we want to know where it came from, what it started in, what animal it started in, and how it was able to get transmitted. We can stop it there first before a vaccine, and then after a vaccine, if we need to produce a vaccine, then we get a vaccine.
Well, after watching movies like Outbreak and things and thinking about how quick this has all happened, as a healthcare professional, it is fascinating and a little humbling to watch. We like to think that we're acting in an intelligent way to make sure we keep our family and loved ones and community safe, but there's variables. So why don't we talk about things that we can do, just general precautions that everyone right now can do regardless of where they are, whether it be preventing risk of common cold, flu virus, or coronavirus?
Perfect question. So I'll tell you, the easiest thing to do, it would be if you are sick, let's say if we're talking about work, if you're sick, don't go to work. Here, and even where I came from in Canton, we always told people, hey, stay home. It's okay. You earn that leave. I know that not everybody has that. And if this is to anybody out there that runs a company, I plead to you, if you've got sick leave, don't punish your people through an evaluation report that they've taken that sick leave. You don't want the rest of your office sick. If they're sick, they're sick. So if you are sick, stay home. If it's, but when it comes to be around your family, avoid that close contact if you're not feeling well. You know your body. And there's nothing manly about, I'm not going to let this cold knock me down. There's nothing, I know that there's that bravado thing there, that goes with both sexes sometimes, but, really, you're not doing anybody any favors by continuing to stay in close contact and to continue to keep up your activity instead of just resting and trying to get over it. Avoid touching your eyes, nose, and mouth with unwashed hands. So let's say you aren't sick and you're walking around the office all day, or and you've got your family and you've got a sick member in the family. Wash your hands with soap and water. Don't overdo it with alcohol. That's not going to actually help you. That's a hurtful thing. It's not helpful. If you cough or sneeze, do that with your elbow. If you cough or sneeze into some sort of rag, one of the most disgusting things would be, which people don't carry around anymore. Remember the handkerchief? That's a one-time use thing. I mean, I know that I remember watching old movies and, people would have that and they pull it out of their jacket and hand it to someone, and then they put it back in their jacket. So I'm so glad we're not doing that anymore. It's not that chivalry's dead, but once I hand it to you, it's yours.
Bottom of the hour, time for the news, Mark. We'll get back to you in a little bit.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White from the Medicine Center Pharmacy. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
If you're worried about the flu and other viruses running around this winter, you need to check out our antiviral and antibacterial products we have in our Medicine Center pharmacies. We have hand sanitizer sprays for countertops, door handles, wipes, face masks, and many other items to help you stay well. It's also not too late to get a flu shot, as well as other immunizations. Plus, don't forget to take a daily multiple vitamin. Our pharmacists recommend Linus Pauling Super Multivitamins, so stop into Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. We're ready for Valentine's Day at the Half Off and Hot Buy store in Louisville. All kinds of candy from Anastasiades to many other brands. Valentine candy bags with a Thai Beanie Baby Sweetheart Bear and many other gift items. Our store also has a new look with all kinds of new merchandise all over the store, with more coming in this week. We also make up special Valentine gift bags to your order. Stop in and you can see how great the Half Off and Hot Buy store in Louisville really looks. See our website, halfoffhotbuys.com, or call us at 330-875-6190.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing the coronavirus with Mark Adams. We've got a lot more to cover this morning, so let's get back to the show.
All right, Mark, before the news break, you were giving us a nice rundown of personal precautions that people can take to minimize their risk of contracting or transmitting viruses or diseases. So how about a quick thumbnail sketch for those of us who are joining us after the news break?
Okay, sure. I think we stopped on the handkerchief one, but to go through it just to touch base, because it is important. If you're sick, stay home. If you're a business owner and you have the ability to allow sick leave and things, allow it. Encourage it. You don't want to infect the rest of your workforce. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth with unwashed hands. So if you're an unsick person, wash your hands using soap and water. 20 seconds. Some people use the alphabet. There's other ways of doing it, but just soap and water. Over alcohol, a lot of people think that alcohol, you can actually overdo it with alcohol. Soap and water is perfect. If you do cough or sneeze, do so and you do it in a tissue, discard of that tissue. Don't keep it. Don't put it in that pocket. Try not to use a handkerchief where it's multiple use. That virus just sits in there. Whether it's flu or whether it's corona, it does. Any type of virus, it's just going to sit in there, and it just becomes this active biohazard that you're going to keep in your pocket on your personal self. I know that a lot of people are watching the news and they're seeing face masks. So I know we briefly talked about perspective, and let's look at that perspective once again. There's no need to go in and do a rush because the same continual snapshots of people wearing face masks end up on TV or whatever source that you're getting your news from. And then that starts saying, well, if I'm not seeing people without face masks, it actually tells a person over and over again, if that's all they see, that maybe I need to go get a face mask. Yeah. That is just not the case.
Well, interestingly, you say about the face masks, okay? Everybody was totally wiped out, okay? And they still
right.
They still were coming in trying to find hundreds of them. And interestingly enough, about 4 or 5 days ago, somebody came to us and they had a ton of face masks. So if you're looking for face masks, whether whatever, we have a bunch of them in all of our stores and our half off store, as well as displays that we've set up in all of our stores that have hand sanitizer, spray for inanimate objects, and wipes and all sorts of things. So we're ready for you if that's the route you want to go. And of course, we have bar soap and all that other kind of stuff too. But Mark's very correct. Please wash your hands frequently.
Right. That face mask is only going to be able to do so much. And if we went back to that perspective between flu and this coronavirus, flu is way more deadly. It is prominent, especially in the United States. We have it. And influenza A and influenza B, it's almost 50-50 with what people are getting infected with. And, if we want to jump to the real importance and what's really happening in the United States, a flu vaccine is what's really going to work. And that's going to, that vaccine that gets produced, they try to get on to the most current what's happening in the world to create that vaccine. So it is possible. that's where I start saying, I know we're going to talk about where to get your information from, but really that vaccine works. Every day I look at a picture of polio, a polio ward in my office, and I have it. It's a big, huge picture. And I brought that from Canton with me because I've used it as a teaching tool for hundreds of students. And, once you had Sabin and Salk vaccine, polio went away. And we know that vaccines work. I know that there's always been an anti-vaccine thing. Way back, even when it was smallpox, there are old cartoons in the 1840s and 50s, political cartoons about anti-vaccines. But really, we have to get the information from a reputable source, and that people that fear is driving, I got to have this face mask. And that's just not what really needs to happen in the U.S. What really needs to happen is that we need to share information and make sure that everybody understands that health departments work together every single day. We talk every single day. We are not compartmentalized. We talk with the Ohio Department of Health every single day. The Ohio Department of Health is talking with CDC and WHO every single day. So we are sharing information. I love this part that it doesn't matter how big your health department, how small it is, we share information left and right. And the nice thing about it was in Canton, we had a couple epidemiologists there that are still there, and they're even doing more towards innovation because it's a large population area. And but I could easily call there and get any information if I was going to talk with Amanda or anybody or Patty. And I love this part because our main goal, and even working with our providers like pharmacies, like you guys, our main goal is just to try to prevent disease, not have to respond to it, because responding responding to us costs so much more money. The money that just really isn't there. So it's, when it comes to prevention, that should be our main focus. And that's with our doctors, our pharmacists, our nurses, our hospitals, our health departments, all of us. That's the cool part is if I could convince everybody out there, do you have people working for you? Yes, you do. And we talk every single day. Even this show itself is a testament to two pharmacists having a show and reaching out to a public health official and discussing this information and getting it out to you. Because at some point, this pharmacy, your pharmacy could be somebody, if there was a vaccine available. I know that you guys are doing flu vaccine, but if coronavirus really did hit, we'd be talking and saying, is there a way that we can do this through your pharmacy? So it's I want people to trust, and your health departments are on it. All of your public health segments are on it. We're talking about it every day, and save yourself some money. Unless there's a medical need, a doctor has talked to you and said you should have a face mask because of either you're highly susceptible to asthma or pollen or some other substance, save yourself the money and try to keep from having to buy any of this or do anything new, anything that you see on the internet. Just try to keep it in perspective. Contact your local public health people.
One more thing on masks, and I just heard this a couple of days ago, that the loop ear cotton masks only have a sort of an effectiveness for like 30 minutes. Once they get wet from your exhale, they're of no value. So it's interesting that that's the mask we see that most people are wearing, as opposed to one that is maybe better produced,
Well, the other thing is the masks are great maybe if you're a spreader of disease rather than trying to prevent yourself from getting it. So
Absolutely. Yeah, absolutely.
All right, Mark, what you mentioned that you talk to the health departments in Ohio every day. Anything else you want to add about some of the foundation that the state of Ohio and health departments across the state are laying for preparation for flu season and or coronavirus risks?
Well, as much as possible, they're working with local providers to be able to get the vaccines out there and be able so that it's a service then that you provide, we provide. But what I really want to get out to people is where to get information. And we have become not just us, but many nations of becoming educated on YouTube and pretending to be professionals after we've read something on YouTube. We're YouTube lawyers now. We're YouTube public health people. And we've really got to get away from those types of sources. While there are some things that are fun to watch, we really need to get if it's going to concern coronavirus or flu, I promise you the only place that's every day updating where the surveillance is coming from, where they're getting information from, it's going to be cdc.gov or the Ohio Department of Health at odh.ohio.gov or your local health department. At Canton, it's cantonhealth.org. At Henry County, for when I shared this for Henry County residents in Napoleon, henrycohd.org. So it's we're posting information every day on it, as most every single health department in Ohio is. We're on conference calls with the Ohio Department of Health every day. We receive an updated information packet from the Ohio Department of Health with what's currently going on, and it usually gets produced and sent out prior to midnight. So we have very active surveillance measures. That is not being covered everywhere else. Those are the sources, because that's our job. It's not to spread misinformation. Our job is to spread as much information that's true, and it's data-oriented, not feeling-oriented. So I'm hoping that people can see the difference between how they feel about something and what they're actually getting data on, and go to those sources. And always double check what you're reading and say, can this even be real? Just that face mask issue alone is one where you can see that people they've bought into that fear part, and did they even bother talking with a single person, or did they just go and get that mask because of something they saw on some sort of source? And really make us work, make us all work. You guys do the same thing that we do. It's all about prevention, all about cure. And when a prescription has to be done, it's about responding at that point. So make us work. Give us those phone calls. Ask us those tough questions. Because it's our job to get that information to you. We work for you. We're your public health departments, and we are responsible to you. So get your source of information from us, because I guarantee it's going to be within seconds of what the current data surveillance is. It's not going to be 24, 48, or 2 weeks old.
You mentioned schools earlier. Are you actively going into the schools and speaking to the students, or how does that work in Henry County?
Yes, I have 4 health educators. We are in the schools not every day, but we're in the schools every week. The other thing is that we do close monitoring. So we have a program that's set up where every single day all of the absences get reported to us here. Now, it's not like that in every health department. It's easy to maintain in a smaller health department, but we are in very close contact with each of the superintendents. So we have a running tab on every student, what they're sick from, how many days they're off, and we report that out to anybody that needs it, just to get an idea of that. That kind of gives us like hey, this is what's happening today in the community. So we get a jump start on flu seasons, colds, other types of diseases in Henry County, because we've got that daily tracking with our students and with our student attendance. So we not only use what's going on in the state of Ohio, what's going on with our epidemiologist that puts together information. He uses that information as well, but we look at that as combining what's going on a state level to also a very local level to a very, very local level in the schools.
Okay, one more thing about the schools, and I guess about Ohio. Who right now, which county has the most flu, or are we all about the same percentage?
Well, the rate of infection remains about the same. So there's no place. I'm glad you asked that question, because it leads me into 2 things. There's no place that we should really avoid. Flu is flu. I mean, the only way to prevent it, it's the rate of infection is going to be just about the same throughout the state. The other would be because that leads me into what when it comes to avoiding. And I saw we've been seeing a lot of information where people are being prejudiced against any type of anybody that they perceive of Asian persuasion. And
I just heard that. Yeah, this morning.
That has got to stop. This is not a Asian disease. This has nothing to do with this. This happens. If it's something that was a novel virus that happened out of the United States, we wouldn't like it if somebody did it to us. So I know that it's happening in various places. I have not heard of it happening in Ohio or in the U.S. I take pride in that. I hope we're bigger than that. We should not be defaming anyone, any population, or being prejudiced in any way.
You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Visit Studio Arts and Glass and shop for your Valentine. We're featuring unique jewelry handmade by American artists, sterling silver, semi-precious, and precious stones. Also, make sure to check out our selection of fabulous gifts created by local artists. Our friendly staff will be happy to assist in choosing and wrapping the perfect gift for your Valentine because she's worth it. Open Monday through Saturday at 9 a.m. on 77 and Apple Grove in North Canton.
If you're worried about the flu and other viruses running around this winter, you need to check out our antiviral and antibacterial products we have in our Medicine Center pharmacies. We have hand sanitizer sprays for countertops, door handles, wipes, face masks, and many other items to help you stay well. It's also not too late to get a flu shot, as well as other immunizations. Plus, don't forget to take a daily multiple vitamin. Our pharmacists recommend Linus Pauling Super Multivitamins, so stop into Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
You're listening to Health Matters with the Medicine Center Pharmacy. Today we're talking with Mark Adams about the coronavirus.
Mark, before we get back to our final segment, I just wanted to add, you've added some really nice commentary about how to take care of yourself and personal precautions from hand washing to different things. But I wanted to also make sure people be aware of, you got to take care of yourself too. So if you're the caregiver in your house, you need to make sure that you're getting adequate rest, you're eating a balanced diet. Don't overlook simple things like a multivitamin or maybe a supplement to help boost your immune system. Vitamin D is a simple thing you can do to help give your immune system an extra boost because it's something that is vital in your immune system defense. We also have some other supplements, at the pharmacy. We've got beta-glucan products like our Immunoguard and our shiitake mushroom products like Empower. There are things you can do to put yourself in advantage. So by all means, wash those hands, wipe down those countertops, wipe off those door handles. But you know what? You got to take care of yourself. 7 hours of sleep a night, adequate water, adequate food. Don't burn the candle at both ends and build a fire in the middle.
Oh, you could. That is absolutely correct. And especially when you mentioned the vitamin D. We get our main source of vitamin D when we're in the sun, and there are some milks that we're milk drinkers, and we lose that because we spend 90% of our time, especially in the winter, inside of a home. And my son is vitamin D deficient, and he has to take a supplement for it. And So it is absolutely necessary. And that sleep one is this time of year. This is the peak. This is our season for flu season. I mean, it's really hitting. And the rest is so important. I'm unfortunately one of those that can only sleep 4 or 5 hours a night. You can probably tell when I'm talking, I'm just a tad hyper. But I seriously wish I could sleep a lot more. I envy some people that can do 6 to 8 hours. I've never even known what that's like. But unfortunately, it's to my detriment that I can't sleep longer, because there isn't a single study out there that shows that 4 to 5 hours is healthy for you. Not a single study. And every study shows minimum 6 hours, but what's the best would be 8 hours of sleep. And good rest, because just laying down and closing your eyes, if it's not REM sleep, it's just no sleep. I mean, it's just not really going to matter too much. So you've just got to, and you got to watch what we eat. It's not every bit of that. Every bit of how we take care of our body is how badly our infection would be, and how easily we can fight off of infection. Because if you live every day thinking, well, it's okay, I can live this way, and I can just go down to the pharmacy and get anything, or go to the public health department and 50% of that prevention of disease is actually on the person, and we need that help to be able to do it. Because imagine if we didn't have people if we didn't have any personal care things, our job, your job, my job would be so much busier. And thankfully, I see a trend of people really going towards being healthier, and especially with what you just mentioned, what's in the pharmacy of what you guys are selling. That when I was in pharmacy school, I never even walked in a pharmacy with those things, and it was all about response, because it had just the medication there. Where, as you've mentioned, you guys have things in there for preventative care as well.
Exactly.
Well, we're ready. Please come and buy it. I don't think we've ever had as much hand sanitizer and inanimate spray and mask. We've never had this much stuff. It's just kind of amazing. It just flip flopped all of a sudden.
Yep, absolutely.
I was in a big box store the other day. Every single employee in that store had a mask on. Oh my, yeah. It really is not. They're just where they're getting their information from is you just need to trust their local providers, because we really do. We have training specifically in this issue and getting information out, and good information out. And I always prided myself coming from the Canton Health Department, because that was our goal, was all about as much prevention as possible. And I've brought that here, and Henry County does it just as well, and I love being out here too. So, very interesting. Before I lose the rest of the time here, I got to tell you, tomorrow the 15th is Brad's birthday. Okay.
Hey, happy birthday, Brad!
We tried to get him on the 14th on Valentine's Day. It didn't work.
I had my 50th this year, so.
Oh, okay.
Yeah.
You're still a young kid. You surely are. You're still a young kid. When you think about it. So, well, Mark, we appreciate you coming on the program is on short notice, too. I called him up a couple days ago and said, hey, Mark, you're going to be on the radio Friday. Oh, yeah, he said. So,
not a problem at all.
All right. Thanks very much, Mark.
Thanks.
Henry County Health Commissioner Mark Adams. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your health care provider. And thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.